Welcome to TelehealthFX Talk. Today we are stepping away from the clinical trial data to talk about the elephant in the room, the whispers, the judgment, the social media comments, the phrase that almost every person taking a GLP-1 medication has either heard or feared hearing, "You took the easy way out." Today, we are tackling the social stigma of weight loss medication. We're going to break down why society is so obsessed with how you lose weight, why the cheating narrative is biologically illiterate, and why your medical treatment is absolutely nobody's business. If you want a healthcare team that treats obesity with science and compassion instead of judgment, visit TelehealthFX.com. That's TelehealthFX.com.
Let's start by naming exactly what this is. Psychologists call it effort moralization. It's this deeply ingrained cultural belief that if you didn't suffer, if you didn't starve yourself and exhaust yourself in the gym, then your weight loss is somehow invalid. We equate physical suffering with moral character. And because GLP-1 medications are so effective at turning down the volume on hunger and regulating your metabolism, they remove a lot of that agonizing suffering. So society looks at that and says, well, you cheated.
And it is the most hypocritical double standard in all of modern medicine. Think about it. If you have high blood pressure and your doctor prescribes you lisinopril, nobody accuses you of taking a shortcut. Nobody says you should really just meditate your blood pressure down. If you have asthma, nobody calls you lazy for using an inhaler instead of just trying harder to breathe. We accept that those are biological conditions requiring medical intervention. But when it comes to obesity, which the World Health Organization and the American Medical Association have explicitly classified as a chronic biological disease, society suddenly throws the science out the window and insists it's a test of moral character.
Exactly. The narrative assumes that obesity is just a lack of willpower, but the biology tells a completely different story. When you have obesity, your body is in what scientists call a defended state. It biologically defends its highest weight as an evolutionary survival mechanism. When you try to diet and restrict calories, your resting metabolism drops. Your hunger hormones like ghrelin skyrocket. The food noise in your brain becomes deafening. Your body literally fights you to regain the weight.
So when you take a GLP-1 medication, you are not replacing willpower. You are fixing broken biological signals. You are quieting the food noise and restoring normal satiety cues so that your willpower actually has a fighting chance to work. Calling a GLP-1 a shortcut is like calling a pair of eyeglasses a shortcut for reading. You're not cheating, you're correcting a biological deficit.
But despite the science, the stigma is incredibly pervasive and it does real psychological damage. Patients internalize this bias. They spend decades absorbing the message that their weight is their fault, that they are lazy. So when they finally achieve success with a medication, instead of feeling triumphant, they feel a sense of imposter syndrome or guilt. They feel like they haven't earned it.
And that leads to intense secrecy. We see patients hiding their medication in the back of the refrigerator so their friends don't see it. We see people lying to their coworkers about how they lost the weight, saying they just cut out carbs. They are terrified of being judged. It creates this toxic no-win cycle. Society judges you and ostracizes you for being overweight, but then society judges you and shames you if you use modern medicine to lose the weight. And this isn't just a social inconvenience. This stigma actively harms people's health. When people feel ashamed of their medication, they are more likely to stop taking it, which leads to weight regain and a return of metabolic dysfunction, like high blood pressure and prediabetes. Fear of judgment prevents millions of people from even asking their doctor about these medications in the first place. They suffer in silence because they are afraid of being labeled as taking the easy way out. So how do we reframe this? How do you, as a patient, handle this? First, you have to realize that you do not owe anyone an explanation for how you manage your chronic health conditions. Your medical history is private. Whether you tell your friends, your family, or your coworkers is entirely up to you. But internally, you have to reframe what taking this medication means. Taking a GLP-1 is not an abdication of responsibility. It is the ultimate act of taking responsibility for your health. You are choosing to use the best available medical science to protect your heart, your liver, and your future. And this is why the environment where you receive your care is so important. You need a medical provider who understands the biology, who doesn't carry that societal bias into the exam room. TelehealthFX was built on this exact premise. It's a private, judgment-free clinical platform. You consult one-on-one with a licensed provider from the privacy of your own home. There are no crowded waiting rooms. The medication is shipped discreetly via 2-day UPS directly to your door. But more importantly, the clinicians at TelehealthFX treat obesity as the metabolic disease it is. They look at your A1C, your inflammation markers, your cardiovascular risk. They focus on clinical outcomes, not cosmetic judgment. They offer Semaglutide, Tirzepatide, NAD+ therapy, sermorelin, and berberine. They give you the tools to rebuild your metabolic health. 24-hour provider review, transparent pricing, no hidden fees, licensed in all 50 states. Visit TelehealthFX.com. That's TelehealthFX.com. Don't let someone else's biological ignorance dictate your medical decisions. You wouldn't apologize for treating a thyroid condition. Do not apologize for treating your metabolic health. If you are ready to step out of the shame cycle and into evidence-based medical care, visit TelehealthFX.com. That's TelehealthFX.com. Take the free qualification quiz in total privacy. That's TelehealthFX.com.
And as always, everything on TelehealthFX Talk is for educational purposes only. This is not medical advice. While you don't owe your friends an explanation, you must always be fully transparent with all of your healthcare providers about the medications you are taking. Individual results vary.
Thanks for listening. If you know someone who feels guilty about their weight loss journey, send them this episode. Remind them they did nothing wrong. We'll see you next time on TelehealthFX Talk.